Hi guys, welcome. As we have seen, the topic of my presentation today is mobile app review and readiness for healthcare apps, and majorly as Nirmita is targeting healthcare sector. So we should know the sessions uh, and the guidelines which Apple and Google follow for approving our apps on their stores. Okay. So the reason why we are doing this session is because majorly two types of apps, Apple and Google, generally put heavy time while approving. Those are first are healthcare apps and second are fintech apps. Healthcare because people's health is involved, okay, and fintech because money is involved, okay. So the fintech part we'll leave it today. We'll just focus on healthcare applications, okay. So, what are the various kinds of scrutinies? What guidelines do we need to follow right from the day one of development, even before the development also? Okay. What do we need to inform the client while even we start the development before? Okay. So multiple guidelines are there, and then there aren't any fixed rules that Apple or the guidelines are there, but we have to go through them. We have to research about everything before putting our app for the first review. Many of us here have developed mobile applications here. Our mobile app developers, they are aware of these many terms, but I think many of us will be developing apps in the future. So you must be aware of such guidelines. Okay. Camera. Yeah. Okay. Next slide. So some pre-submission technical checklists which should be there. Okay. So these follow for all apps, but specifically healthcare apps, we need to follow this. Okay. So first and foremost, before even starting development plans, okay. Once your project managers or your managers have developed a project plan, okay, and they have presented to you with the project plan, okay. Even before this step, you guys need to decide uh, a fixed stage of the app to suppose 10 or 20% of the app should be completed, and you should be ready to ship that app for Apple's and Google's approvals fast. Because even if your timelines for developing a particular app, if we say are about 3 months, Apple and Google can take additional 3 months just to approve that app. And then client won't have another 3 months just to wait for that. Okay. And then even if the cycle goes on, client will listen to you for once, for twice, but as the review cycle continues, he will lose your confidence, okay, on you. So what we do is we decide a stage where we have developed about 10 to 20% of the app, and we decide that this could be the app which could start the process with Apple and Google, okay. So that you have to decide with your team and then ship the app, okay. But for that, all the functional flows should be completed till that part. No placeholders or test content should be present in that. Okay. No crashes, freezes, or UI issues. Okay. Sentry and Crashlytics should be integrated. Okay. So these basic tests are the first ones which Apple and Google test your app. Okay. And then you guys need to decide what kind of OS till it will support and what kind of devices it will support. So these are the basic technical checklist. Yeah, and then majorly when dealing with healthcare apps and for the HIPAA compliances, major part is data sharing of the users, right? PII, personal identification information. So request your client to provide the privacy policy, and it should be accessible publicly right from day one. Ask your project manager or ask directly the client to provide the privacy policy. And in that privacy policy, these all factors should be included. What kind of data is collected? What is the usage of the data? how are we storing it, what are the backup policies, how are we processing that data, why the data is needed, is that data being shared with any third parties, or how it is shared internally. That all should be present in the privacy policy, and that should be submitted to Apple and Google, and it should be accessible to the users also, normal users of the app. Okay, and this applies for iOS and Android as well. Okay, next. So yeah, and then when dealing with healthcare related specific permissions, there could be many apps wherein you require location data, camera data of the phone, various permissions. But when it comes to healthcare, and then these permissions being accessed by the user for particular healthcare apps, Apple and Google, uh, they scrutinize they scrutinize the apps very diligently over this. So you need to provide exactly the reasons why you need, suppose why recording information, microphone information is needed, why location data is needed. You need to specifically provide that, and then basically you need to provide, or just let Apple and Google know how the data is encrypted and not being shared with any other parties. So the required encryption of the data should be present. And for last one, the explicit in-app consent form. So in every app, you be having a in-app privacy policy or consent form from the user, right? So this is necessary. Even if the designs which clients have provided, or the UI UX team has provided, that doesn't include an exclusive in-app form, you should include it, because this is one of the necessary guidelines which Apple and Google, they mentioned in their guidelines. Okay, and then all the policies which are there in HIPAA, okay, related to data, related to information, how it should be stored, how it not should be shared with any third party providers. So those need to be followed as well. Next. So we'll look at some specific Apple and Android related guidelines, or some reason why apps are getting rejected. Okay. So first and foremost, very common reasons are, Apple states that the app should be visible as a public users app, not as an internal app. So suppose there are few hospitals which develop app for their internal purpose, right? So those cannot be put up as a public users app. Okay, so you cannot put that app for public. So for internal apps, if there is an app which is going to be used specifically for hospitals, those apps, the those apps, so there's a different way of releasing those apps. Okay, so that should be taken care of. Misrepresented medical device features. So it's very necessary that if you ask for a connection, or if you ask, suppose if you're asking for a camera permission, your app must feature that. Okay, so unnecessary informations. So your app must provide that. Okay, so your app must properly explain that in their features, in their privacy policy, why the camera is being used. Okay. And so basic requirements are, your app must inform that how be useful for the public. Next is clear disclaimers. Demo log credentials should be working all the time when app has been submitted, and review notes, and any AI safety controls. So complete reliance of AI on a, suppose your app is using an AI, you must show Apple and Google that AI is not being used to diagnose a particular health condition, right? It is just used as a way of supporting it. If you, in any of your documentation and in any of your app, showcase that AI is assisting in diagnosing anything, your app will get rejected. No one app on the App Store is there for diagnosing any health condition. It is just a way of supporting it to get your help in diagnosing any health condition. Okay. And then on top of it, if you are saying that AI is being used, that your app will definitely be rejected. And then multiple so even if you give everything information that is required, right, and there isn't any proper evidence to prove it, Apple will straight away say that this is a misleading claim, okay, and then your app will be rejected. So every time a review comes back to you, you can't reply it in a single line or in a single paragraph. What you should do is, even if the rejection is small, okay, is of a minor level, you must ensure that you give a proper reason with uh, good content on it, and you must provide appropriate attachments such as video proofs or images with it. Okay, the more you show seriousness towards replying towards the rejections of Apple, the more are the chances that Apple will take you also seriously for the reviews. Okay, just a minute. हेलो. अरे एक मिनट में प्रेजेंटेशन में एक मिनट. 795725. हाँ. Okay, and yeah, and as I said sometime before, privacy policy, utmost essential that the client must provide a privacy policy, and then the privacy policy must mention how the health data is going to be collected, how it is going to be used in the app, right? So those are the things. Um, Even if you are using any third-party SDKs or third-party APIs, you must provide proper permissions and justifications, okay, for that usage also. Okay, so one example I'll give you guys is recently we are working on an app. Okay, it was a healthcare app, Well Station. Uh, Devesh was working with me. So there was one specific requirement as key uh, client had said key we would not support iPad for the. So we had specifically mentioned while submitting the bill, okay. But in the Apple's guidelines, it states that even if you uncheck it, they will test it for iPad. So now on the one side, the client is stating that we will not support iPad, and on the other side, Apple can check for the your app on iPad. So that is a conflict of interest, right? So you fall in between. So in such cases, you have to go with Apple. And you have to make your client understand that even if you decide not to go with iPad, Apple will check it. Hello? Hello? Hmm. Okay, next. So these are some Google Play Store related healthcare guidelines, okay, which you should follow. So basically, small changes, small, important things, as in providing appropriate screenshots for that for your apps. Okay, Apple does check what your screenshots are implying. Okay, does it properly explain the uses of the app? Even those, due to the improper screenshots, your app could be getting rejected. So, so even if the client provides out or mental health patients, okay. So these are just not just just getting apps of such kind getting approved by Apple quickly. There must be proper evidences such as citations, research articles by conducted by proper scientists. Such kind of evidences must be provided for Apple and Google to get your app approved. So these kind of citations and evidence-based research articles, those you could get from the clients. You could request on them. So that could make a very good case for your apps getting approved quickly. Okay. And yeah, so major part is building the UI UX properly. Okay. Uh, UI UX team, even if it's from the client side, once they provide you the UI, they may not be aware of these guidelines. Okay. So during the development, when you see those UI UX and then you feel that some guidelines should be followed and the UI needs to be changed. So these are the things you should go through and then you should communicate to the team, UI team, that the UI needs to be changed. So some examples are all features, terms and conditions, privacy policy, consent for data usage, contact support, medical guidance, delete his data, clear his data. All of this should be under the settings of the app. Even if one of this thing is missing, your app is going to be rejected. And then user clarity requirements. All the features that you are mentioning in the app should be properly mentioned in the App Store information while you are giving to Apple or Google. All the screenshot must follow them. And right, I said before, when you are dealing with AI, it should be AI labeled as assistive, not diagnostic. Anywhere you mention that AI is used for diagnosis, your app will be getting rejected. You can mention it as assistive, it is assisting the user for a better insight on his condition, health condition, it will be good. Okay. Yes, and then these are the set of documentations that are at most necessary. First are the app review notes. Okay, app review notes do include, like I said, the citations, research articles, your privacy policies, and everything. All should be accessible by the user. All should be accessible by Apple and Google as well. And demo login credentials, test 8 to 9 permissions we are taking from the user, right? So we had to properly mention to Apple, to Google, what kind of permissions, why are we using them exactly. We received around 4 to 5 times, more than 4 to 5 times rejections just on the permissions. Exactly why do we need them? Even if you diligently explain them these are the permissions and we need because of this, they can scrutinize you on that multiple times. Okay. Yeah, and then data handling documents, storage and everything. Data safety form. There are multiple forms which, so there are categories, right? In healthcare also there are categories when you decide to put your app for submissions. There are categories you need to select, and based on those categories, there are various data safety forms you need to fill. Okay, and then depending on the country which you are releasing the app, there are also local laws that apply and you need to follow. Okay. Next. So yeah, and then so this is for the QA as well as the dev team also while testing. Okay, specifically while dealing with healthcare apps here, we need to be more careful because this is going to affect someone health support. It's going to somebody's health. So proper testing activities should happen. For internal QA, these all scenarios should be tested. For security testing, these kind of testing should be taken place. Okay, and for accessibility testing, you know, people with disabilities, old people generally are at a higher percentage who use healthcare apps. Okay, so it's our responsibility as well to make accessibility settings or your app accessible to most of the general public. Okay, next. So these are the best practices, you should follow. Even before I said, before starting the development, you should sit with your team, you should decide a fixed amount of app completion, and that you should start the verification with Apple and Google quickly because it is going to take time more than your development time as well. So the quickly you start dealing with Apple and Google in the development cycle, the better for you. But for that, you need to be better prepared, right? You need to have experience, so such guidelines can help. And then while submission the final package also. Even if you follow all the guidelines and everything, when you submit the final app, the real game starts there. The initial with Apple or Google, those can come again with Apple. You have to again them make them explain. Okay, because they do test it, but once you present the app for a final build, they test the app completely as well. Okay, and then yeah, monitor feedback, prioritize quick responses. You show seriousness to Apple and Google that you are serious, you are not delaying responses. They will show seriousness towards the app as well. Okay, I think this is last line. I think yeah. So yeah, I'll share this with everyone. And then yeah, there are many people who have worked on these apps, specifically healthcare apps. These guys do have experience in this. And then yeah, whenever Apple and Google are involved, there is no particular guideline or there are no specific path that can lead you to getting your app quickly approved. Okay, so you have to deal with your client, you have to deal with Apple and Android as well, and you have to deal internally as well. Okay, so yeah, this is it. Thank you.